Well, good morning. Welcome to our bi-weekly press conference. I'd like to welcome Dr. William Remington from the Kosciuszko County Health Department, Bowen Center, Kirk Carlson, who's leading our testing charge, and County Commissioner Carrie Groeninger. I think we've got a lot of things that we want to do today. We got a lot to talk about. From the city and county's perspective, I think the big thing is continuing to utilize funding that's available to us. We're looking at CARES Act dollars are being have to be spent by the end of the year, so we're working to pay those bills that we've agreed to pay with regarding to the testing and other COVID-related supplies. I know the county and the city both have allocations that need to be spent by the end of the year. Although there is some flexibility there, we're certainly also awaiting how the next CARES Act funding would look for communities, for our health departments, for our schools, for our businesses. So a lot of unanswered questions, but certainly know that we're all on top of that right now. We're also potentially looking at updating the emergency relief funds for some of our businesses. Nothing's been done on that yet, but we're certainly taking a look at that as well. So with that, I think I'll just introduce Commissioner Groeninger. I know he's probably got just a few things to say, and then we'll get over to Dr. Remington. So Commissioner Groeninger?
Yes, good morning. Joe, thanks for inviting me here this morning. Just want to reach out and just kind of just let the public know where we're at as a county. You know, that we're just want to know that we're working with our health department. You know, we're kind of letting them take the lead on what's happening there, but just to make sure that we've given them the tools and the resources to be able to do what needs to happen once we know what's going on, especially with some of the things with testing and with the upcoming vaccination, making sure we've got those venues or whatever we need to get located are allocated to them, make sure they've got the tools to complete their tasks. So other than that, you know, I'm going to let the smarter heads in the rooms talk about what some of the plans are and what's going on from here. But just rest assured that we're 100% behind our health department and supporting them, and as well as the Bowen Center doing our testing on making sure they have the resources they need. So that's all I have this morning.
All right, thank you, Commissioner. And with that, I will turn the discussion over to Dr. Remington. I know he's got a lot of information he'd like to impart on us today. So, Dr. Remington?
Sure. Thanks, Mayor. Well, first, the statistics. Kosciuszko County, like the state, is seeing substantial numbers of cases, hospitalizations, deaths. The hospitalization burden in both the South Bend and Fort Wayne tertiary care hospitals is very heavy right now. I had read in the Times-Union earlier this week that Goshen Hospital had canceled semi-elective surgeries because of lack of bed capacity. So again, it's a real deal. Kosciuszko County is orange, not red, which is a pleasant surprise. We'll take it. So we will continue our current mitigation strategies and educational/enforcement strategies as a county. We're limiting capacity at indoor venues as well as outdoor venues, and limiting capacity at special seasonal events. Testing is pushed, perhaps not quite as pushed in the queues at the Bowen Center's testing site apparently in the last several days, but the reference labs are still pushing capacity, and I know the state has been aware that turnaround time is still a little bit slow with the reference labs, but they still are able to accomplish the job of handling a large burden of lab volume from all the sampling that's being done at testing queues like our own queue at the fairgrounds. So again, thank you to Kurt Carlson and the Bond Center staffing there for pulling that off for our community. Very, very important and much appreciated. One of the changes in the last week from the CDC was a shift in the quarantine guidance. This again is the guidance that you give to close contacts without symptoms. And if you are able, you can shift and must get back to work and remaining symptom-free, you can free yourself up from a quarantine of 14 days at 10 days and go back to work with a mask on. The preference still is that you try to complete a 14-day quarantine at home if you can, but we all realize that the quarantine directive has been a real challenge for society. So there's a little breath of fresh air in seeing a shortening of that quarantine period. It can be even shortened to 7 days if you're able to test and get a result at day 5, 6, or 7 into your last exposure with your known contact case. Now, I'll just say that's going to be logistically almost impossible to pull off. So we in this county and many counties would, and actually at the state, their preference is that we try to maybe use the 10-day test-free approach to freeing people up from quarantine. And again, just to refresh our memories, this is not isolation. This has nothing to do with the ill person who is told to isolate from work, from society, if you will, for 10 days. You do not need a repeat test in that strategy to go back to work, to go back to society. You complete your 10 days, and as long as you're clearly symptomatically much improved and you're fever-free for 24 hours, you may return. So this shortened duration applies to quarantine, specifically and formally using that term. Therapeutics are available. The monoclonal antibody intravenous infusion from Eli Lilly is now available in 55 sites across the state of Indiana. Our own local hospital, KCH, is one of them. This is for outpatients at increased risk for a bad outcome. This is not to be used for people ill enough to be in the hospital. And there are some pretty specific inclusion criteria for that. Age is one of them, 65 or older, but there are other inclusion criteria such as obesity, diabetes, chronic lung disease, etc. So if you are ill with a test-proven case of COVID and you're within the first 7 days of that illness, and you feel you are a high-risk individual, you should contact your primary care physician if you have one, or seek care at a clinic if you're quite concerned, and to see if you qualify for an infusion of a monoclonal antibody. That all has to be formally scheduled, but it is available here locally. And anecdotally, I've heard good reports from response to that. Most healthy people will get through a COVID infection without the use of that product, and this is not intended for them. Vaccine is coming. That is the big topic at our local health department and community planning and planning at both the federal and the state level, I would say. This will be rolling out in a federally designated phased approach, and what's called phase 1A should see vaccine going into the arms of Hoosiers within the next 10 days, we think. This will be at specific hospitals across the state, and we have local hospitals participating in that. The first to get the vaccine will be healthcare workers at the very front lines of exposure with COVID. There are 400-some thousand healthcare personnel, as I understand, in the state of Indiana, so there will not be vaccine for all of them up front. So even in this earliest tier, there will need to be sub-prioritization as to who gets the earliest vaccine. Each week we're into phase 1A, there should be more liberal quantities of vaccine available, and that sub-prioritization will shift around pretty quickly. There is some reactogenicity with these early products, both the Pfizer and the Moderna product. These messenger RNA vaccines can provoke local site soreness and constitutional symptoms like a fever and headache and body aches. So if you're a healthcare worker, you don't want to gather all your fellow healthcare workers and have a vaccine party on the same day, because you may all feel just a little crummy the next day. Those are not severe reactions, and you do not need to be prohibited from work, but they are a real thing, and so should come into our thinking as we roll out these mRNA vaccines to the healthcare workforce. Long-term care facility residents, nursing home residents, are also part of that 1A vaccine rollout. That will be coming from the federal level, with federal contracting with CVS and Walgreens going directly to the nursing homes to immunize the residents in the nursing home. And as I heard on a conference call with the state yesterday, 100% of the nursing homes in the state of Indiana have designated that they have selected that national pharmacy partner to help them pull that off. So that is certainly light at the, toward the end of the tunnel with this pandemic. It's going to take a while to roll out the subsequent phases. The timeline is not clear, even to those of us close in conversation on this. We're going to need lots of partnering to pull this off. And whether we can find a way to do a mass immunization clinic strategy is not perfectly defined just yet for our county. Bowen Center's approach with the drive-up testing is certainly a provocative idea with immunization strategy, but there are many details to work out yet. But it's coming, so be patient. Continue in the meantime to wear masks and demonstrate social distancing. Limit your congregate gatherings around the holiday season, and we'll get through this. Thank you.
All right, thank you, Dr. Remington. I'm sure there'll be some questions. Hopefully, most of them we can answer, but I'm not sure as things continue to evolve on the vaccination front. Pivoting a little to our local testing site, Kurt Carlson from Bowen Center is here. I'm going to turn it over to Kurt and ask him to talk about our testing.
Thank you, Mr. Mayor. The week before the Thanksgiving week, we saw our all-time high of 1,672 cases. We were closed, the testing site was closed the 2 days of the Thanksgiving holiday, so we dropped down to 854. The following week, I'm not sure if some people were still traveling or what, but we crept up to about 915. And it looks like the pattern now is more people are showing up in the morning and less in the afternoon. One of the problems of a big spike on Tuesdays when we were closed Sunday and Monday appears to be resolved, and so now Monday is our busiest day and has been for the past few weeks. So it's leveling out more over the week. Saturday is our lowest day. In terms of in the future, for the Christmas Eve, instead of being closed, we'll be open from 9 to 3. We understand that is common for most of the testing sites in the state. We'll be closed Christmas Day, then we'll be reopened Saturday from 9 to 3. And then New Year's Eve will also be open 9 to 3. will be closed on New Year's Day, and then Saturday reopen. The state made a particular request that none of the sites be closed 2 days in a row, and so we are honoring that by being open all but the one day that we're closed, and then limited hours. So it continues to be a pace that our staff can keep up with. The team has become very, very efficient and effective, and I haven't, in the last couple of weeks, had to draw in a lot of my extra staff to handle spikes in that, and so that's really good news. So as of the end of last week, we have already tested 8,601 persons. We're probably over 8,700 now. So it continues to be active. Dr. Remington, one of the things I heard this morning about the vaccine is there were a couple of people who have a long-standing allergy to vaccines, had a negative reaction. So I don't know if you want to comment on persons who have pervasive allergies that might be affected, whether they would be good candidates at this first round for vaccines. Again, just one of those nuances that they're finding as they're doing this in England, and that was one of the early findings. Bowen Center stands ready to participate in any way that the state believes would be a good task for us as part of the vaccines. Again, as Dr. Remington says, we don't have any of the details for subsequent phases, but this first 1A group, we have a number of frontline staff, and talking with Jay Dale of KCH, who will qualify, but not all of my staff. Again, we have 1,500 staff, but it can only be a small percentage of that who are in direct line with COVID patients. And then we, again, we want all of our staff to be vaccinated. We're not going to make it mandatory at this point, but we're going to use a persuasion campaign to help people see why it's best to do this, to get to that 75% of the population vaccinated, to get that herd immunity, so we're all in a safer place. So I think that's all I have to report.
All right, thank you, Kurt. I appreciate it. Dr. Remington, do you want to comment on the allergy question posed by Mr. Carlson?
Thanks for bringing that forward. I'll be honest, I personally had not heard that yet, Kurt. I listened in intently to the Chief Medical Officer's discussion regarding the vaccine products at noon on Friday last week. I did not hear that discussed. So I have not heard, other than pregnancy and young people, I mean, under age 17, I have not heard of a specific contraindication to the vaccine.
Yeah, it came out of England, and it was just this morning, I think we found a couple of the healthcare workers that had long-standing allergies, and they were just caught, and it was another caution.
Well, I think we'll all want to stay tuned to the growing experience with these novel vaccines that are being used early in the COVID experience. And I welcome vaccines, and I will line up for a messenger RNA vaccine as soon as I'm eligible, depending on how the sub-prioritization goes. But we'll all want to be wise, absolutely. Vaccine strategy is a profound way to try to bend the curve of the population experience with this new aggressive respiratory pathogen, and we need it. And I applaud the strategies that put tons of financial resources into having vaccine products quickly brought to production, awaiting their authorization, which was novel. So we still need to get it into arms. We need to be wise as the population experience grows with these vaccines. It's okay to be thinking as we go forward. So your point's well taken, Kurt. Thanks.
Thank you. Before we start with our questions, I just want to remind everyone how difficult this has been, and we know it's been very difficult for everybody. But I especially want to call out the Kosciuszko County Health Department. You know, as this thing started out, they were working with the epidemiology and trying to understand the numbers, and then they pivoted quickly to being responsible for the testing locally here. Then all of a sudden, contact tracing became another burden on them. Then enforcement became an issue, and now this potential mass vaccination rollout is going to add another significant burden to their department. And I know at the beginning of the year, I don't think the commissioners or their county council understood what was going to happen. I don't think anybody did. And I know that by supporting the health department with cooperation on a lot of these precautions that we're being asked to take, anything we can do to lighten the burden by just showing a community collaboration and cooperation is certainly going to help with the heavy, heavy burden that the health department has undergone. Certainly, the Bowen Center taking on the testing, they're maxed out as well as far as that program. And I know between the commissioner and myself, we're certainly trying to do everything we can to support the organizations, the local, everyone who's trying to get us through this thing, and we just ask for that cooperation with a lot of the precautions that have been asked for. So thank you for that. I will, as I do normally, mention that masks continue to be available at Fire Station 2 across from Owens, and I know Owens Kroger's, and I know Ann Sweet and her group, I think last count I'd heard they made 13,000 masks. So it's quite an effort, and certainly they are available. I know as Dr. Remington mentioned, the CDC quarantine guidelines are hopefully making it a little more user-friendly, but please try and adhere to even the updated requirements. That little bit of shortening might help. But again, I know the city, and I'm sure I can speak for the county, we're certainly willing to stand in support of all these efforts and all the difficult tasks that are being asked of our community health department and all our organizations that are helping. So as you might have noticed, we are virtual today, and I think we'll probably continue. This seems to be working out pretty well. I'm sitting here in our council chambers by myself. Through the miracle of technology, I think this works well, and we'll continue with that. So with that, I will turn it over to, I know we have Amanda joining us from the Times-Union, and I've gotten some questions texted into me from Dan Spalding at Ink Free. So Amanda, I'll give you the first shot. If you want to unmute.
Yeah, hi, thanks. I guess my question might be more so for Dr. Remington. This weekend, I know that your health department has given some special permission to this, 350 person limit gathering for this annual Susie McIntyre concert. I guess what the mayor just talking about, the community doing everything they can to lighten the burden on your health department. Do you feel any concerns about, I guess, making that allowance?
Yeah, that's an honest question, and I'll give you an honest answer. I have wrestled with that one. That is a beloved community event, and we have, Bob Weaver specifically at the health department has worked through the latest version of the governor's executive order to the T with them, and has almost week by week had conversations to mitigate the risk. So the event that will be pulled off, barring any complication between now and then, is a mitigated event. It's not a full-fledged event. I don't know that any of us know the perfect boundaries on what's excessive and what, either in restrictions or excessive in attendance. I think this one will be carefully done. We go as a county, we'll have a harder line, a stop line for special events like that. So we are still orange, so we are still at play within the governor's guidance. And that event has worked carefully with us at the health department. And the state actually has looked over our shoulders at that specific event. So right now it's a green light, barring, and I think that's this weekend, right? So we shouldn't be red between now and then. So the event will occur much different than it was originally intended. And we certainly don't need a dozen more of events like that, in my opinion, in the next month. So these are tough calls. I think I feel fortunate, again, to be in a smaller community where we can try to wrestle together with these decisions. So.
Okay, thank you.
Yeah, you bet.
All right. Any other questions, Amanda?
Not right now.
All right. Well, we got a few more, and you're certainly willing to jump back in if you need to. So I'll start with question number 1 that's been posed by Dan Spalding from the from Ink Free, and I will quote his question. As we go forward, should the public assume another national lockdown is not likely, and instead folks should rely on local government, businesses, employers, and schools to decide any new restrictions? I think that's probably directed towards myself, maybe, and the commissioner, and I'll take a crack at that. I don't know that we can assume anything. I would hope, and from what I've seen, it appears that even with the much higher case count than we had back in the spring when we were shut down, we are at a point where we are managing this very precariously. And I don't know if this would skyrocket again, if we would go towards that national shutdown. I really hope and pray that does not happen. I don't feel like it will. But again, that's just always the pretext for asking folks to continue to make these precautions and things that we can do to prevent the spread. And we all know what that is. We all know that it's wearing masks. We know that it's any gatherings, practicing the social distancing and the hand washing, and everything else that we've talked about, quarantining, isolation. When you're sick, stay home. Just all the things we've continued to talk about. I'd like to feel that we have understood this disease a little bit more. The CDC has continued to update, as it's gotten data, its protocols, and we heard one example of that today. So my hope is that where we're at right now, we'll be able to get through this with everyone pulling together, and that we won't have to go back to any type of shutdown. Obviously, the vaccination will take some time. As you heard, logistically, it's going to be very difficult to get this thing rolled out, but with the availability of the vaccine, it'll just be a matter of the state health department and the local health departments working with all of our partners, all hands on deck, to get this vaccine rolled out. So I feel like we have been relying, since the governor pivoted to more of a county by county statistic. I happened to be on a meeting with him and some mayors last week, and commented that I thought that the pivot from state statistics down to focusing locally made those statistics much more impactful to our local citizens and government, in that, these are our statistics. It's not a broad state statistic. This is in our backyard. And I think that's helped make those statistics more credible and for the public to understand how important it is that we've got to take care of what we've got in our own backyard. So that was a long-winded answer, I think, to the question, but I'm at the end of the day, the summary is I think that we are handling it locally with state guidance as best we can, and with the vaccination, I think we'll get through it. Carrie, do you have any comments to that? I certainly don't want to speak for you.
Probably the only thing I would add is, I think you stated it well there, Joe, but just I think we have to be careful of the fact that, when we shut everything down, there is for every action, there's a reaction, or every cause there's an effect. That we have to be careful about, some of the businesses that have been hurt the hardest, not that every life isn't precious and we don't want to make sure we're keeping people healthy, but, I think trying to mitigate this thing, and I think the other thing is it's become a lot more real for people, over the last couple of weeks, just that you don't have to go very far out in your circle of friends that somebody that's had it or a loved one. And I think that people are being more cautious and wearing their mask and trying to social distance and do those things that can help make a difference. That I would really hate to see that it would ever have to get to a point that we'd have to do some sort of a lockdown, because I really do believe there's some of those things that are doing maybe even more harm than good. But it's all things that would have to be looked at. You can't ever say never, because we don't know what lies ahead of us. So all will just have to be looked at.
All right. Do either of you, other gentlemen, have a comment on that?
I have no further comment. I think both of you have expressed the sentiment and the conservatism of our county, and I'd say for probably the majority of the state of Indiana, that level of conservatism toward this, and finding our path through the willfulness of the population is a substantial part of this whole thing, So, again, to say it again, very fortunate to be living in this community where we're having these open discussions and respecting all sides of the equation.
All right.
It's a tough balance to protect life, protect health, and still continue to operate as a society. There's no easy answer, and I appreciate, as Dr. Remington said, a community that really is very thoughtful and mindful about it.
All right, thank you. Question number 2 from Mr. Spalding, and I'll quote, any thoughts on the president-elect's priorities and his request that all Americans mask up for 100 days? Do you expect meaningful changes in the federal government's approach to the pandemic? And again, I'll take the first shot at that one. I think that I think we answered it in the last question. I think the majority of the control here is coming, as far as the boots on the ground, is coming from the state, and most importantly from our county. I will add, however, that the funding, as we talked about, the CARES Act funding, the relief for small businesses, that would be the critical role to me of the federal government in funding the vaccination attempt, the testing, the PPE, the contact tracing, everything COVID related. Obviously has a very big expense, and the federal government certainly has taken the lead on that, and I assume will continue to do that. As far as, again, masking up for 100 days, I don't think that mandate would impact our community, because we are currently listening to what the governor has to say. I think we've done a reasonably good job of that, and again, as the vaccination comes ahead, hopefully we'll at some point get away from that. Carrie, any thoughts on those questions about a 100-day mask order or any change in the federal government's approach to the pandemic?
Well, I think we've pretty well talked mostly about that, but I think, we have a very conservative community, and I think, if we can encourage people, you get more with sugar than you do vinegar. I think if we can encourage people and help them understand and educate them why it's important for them to do these things, the mask, the social distancing, I think we're going to have a better success rate than some mandate that's saying you got to do something. I think that's the wrong approach for our community.
All right, thank you. Question number 3, and I assume, Dr. Remington, you've kind of answered this, but I'll give you another crack at it. Question and quote, how soon will it be for local residents who are not high priority to receive the vaccine? Any thoughts, any crystal ball on when you think the timeline how it may emerge?
I think we're probably looking at March or April. It's an educated guess.
All right, and as long as you're here, the fourth and final question is, and I know you've talked a little bit about this, but what will the vaccine distribution look like locally? I think you've addressed that, but maybe expand on some of the options that are being tossed around.
Yeah. So 1A is hospitals. 1B is health departments, federally qualified health centers, community clinics, and I'm not quite sure how broad in a clinical setting venue that goes. So 1B is big. 1A is big enough, as I mentioned, that's going to take a sub-prioritization amongst the healthcare personnel to figure out who goes first. And I think there's going to be lessons along the way. Our early thoughts at the health department are to enhance our staffing within our immunization clinic and to find the right venue where we can maybe try to achieve several hundred doses weekly with our immunization staff. This sounds as though the model that's coming to us is one where these immunization clinics may need to be used for weeks or months. So in my mind, that speaks against a mass clinic on 1 or 2 occasions in school gyms, because I don't think that's the strategy. What I'm hoping is that at the federal level, there will be a very quick expansion into many venues of administering vaccine, that they don't overly hang on health departments and federally qualified health centers, that they quickly have a private-public partnership that's very evident. So you show up at your doctor's office or perhaps an urgent care clinic, or I think prominently there should come now these large corporate pharmacies, or any pharmacist that's willing to do it. Think of the hours of availability, the number of venues there are, even in our own county, if you can quickly get to the pharmacies. Whether or not that will play out quickly is the timeline and the scale along that timeline is just so indeterminate right now. But I philosophically think the more serving lines you can get to, the quicker, the better. We will want these vaccines. It's a great way to mitigate this pandemic.
All right. Thank you, Dr. Remington. Amanda, before we sign off here, any final questions? Are you all good?
Yep, no more questions, thank you.
All right, we thank you very much for joining us. So again, appreciate the time, appreciate all the efforts of the entire community. Please support our local restaurants and businesses as you can. I know it's been really difficult on them. We're hoping that some stimulus will come through for them, and hopefully we can make some arrangements locally to assist. But at this point, the only other thing I have to say is again, thank the health department for all their hard work. Please all be mindful of how hard they're working, how difficult their job is, and I think everything you do will be helpful to them as long as we're doing what's asked of us. So thank you. We'll be back in 2 weeks. We'll be virtual again like this. If there's a need to pivot or change, we could be back within a week. But for right now, we'll see you back in 2 weeks. So thank you all, and thank you, Commissioner Groeninger, Kurt, and obviously Dr. Remington. All right, thank you all. We're done.
Thank you.